New testing requirements for anyone traveling into the U.S. took effect today. President Biden announced the new restrictions last week as part of his plan to combat the coronavirus as cases of the Omicron variant spread. Now, all travelers, regardless of nationality or vaccination status, must show a negative COVID test taken within 24 hours of travel to be able to enter the country. And additional regulations are being announced. New York City Mayor Bill de Blasio is issuing a vaccine mandate for all private employers. This is the first such mandate in the country. It will go into effect December 27th. But there is some good news out of the White House about the Omicron variant. Chief Medical Advisor Dr. Anthony Fauci says preliminary data about the strain is, quote, encouraging, but says more information is still needed. CBS News' Skyler Henry has the latest.
Beginning today, all travelers flying into the U.S. will have one more thing to do before boarding their flights.
We want to go around roughly 3 or 4 times in a circle.
Everyone aged 2 and up will need a negative COVID test at least 24 hours prior to takeoff. Previously, you had 72 hours to get tested. The rules cover vaccinated and unvaccinated passengers, and they also apply to U.S. citizens as well as foreign visitors.
We found out just randomly, so now we're like, well, do we wait? Do we do our test today? Do we do it tomorrow?
So far, there have been 0 deaths reported as a result of Omicron.
Thus far, it does not look like there's a great degree of severity to it, but we really got to be careful before we make any determinations that it is less severe or really doesn't cause any severe illness comparable to Delta.
As of now, all of the cases in the U.S. have been mild, but the variant is already in 17 states, and its spread is just getting started.
Really what we're going to see is over the next 3-4 weeks, dramatic increase in the number of cases of Omicron. And it's a perfect storm, right? The weather's getting colder, people are getting together for the holidays.
While scientists say there is still much to learn about Omicron, the early indicators out of South Africa show that being vaccinated and boosted is the best defense.
If you get boosted, you're going to get your level up, way up, and we feel certain that there will be some degree and maybe a considerable degree of protection against the Omicron variant.
New York Mayor Bill de Blasio announced this morning that beginning December 27th, all private businesses in the city will need to require their employees be vaccinated. Skyler Henry, CBS News, Washington.
For more on this, I want to bring in Dr. Rob Davidson. He is an ER physician and executive director of the Committee to Protect Healthcare. Dr. Davidson, welcome. So the Omicron variant has been obviously at the forefront of most conversations, but Delta is now making a comeback. It's almost as if this is a tale of 2 variants, right? You're in Michigan, where cases have been on the rise and hospitals in certain areas are filling up. Can you tell us what you're seeing there?
Yeah, we've had the most sustained surge that we've seen throughout this pandemic. Remember, in Michigan, we had another one back in the spring after the November-December surge that most of the nation faced. And we've been in West Michigan, especially since the beginning of November, we've been dealing with full hospitals, emergency departments boarding patients. I'm an ER doc in a small rural hospital, and we're routinely boarding, up to half of our department filled with patients who don't have inpatient beds who need to be admitted. So, it's just unvaccinated people are about 90% of the people we're seeing that are requiring hospital care. And even of the vaccinated people, the ones that we're seeing that are really sick are the folks that could have been boosted but just hadn't gotten the booster dose yet, or that 3rd dose. So it's been a challenge. Of course, Omicron is concerning. We have to be thinking about it, but we are stuck in our Delta surge that, I can't imagine it getting any worse right now.
Incredible.
But we're bracing for this post. Yeah.
Yeah, no, listening to what people are going through in certain areas of the country and then hearing about this other variant on the heels is very concerning. We understand that the Omicron may be even more infectious than the Delta because it shares some of its genetic code with the common cold. So, Doctor, in terms of what we know about it so far, is that fact, the fact that it shares some genetic code with the common cold, a good or bad thing in terms of its infectiousness?
Well, it depends, right? If it retains some of the lethality of the original strain or the Delta strain, along with that increased contagiousness, that would be a huge concern. The common cold obviously isn't fatal. It isn't dangerous. It's highly transmissible. So if more of that, those characteristics dominate, that would be, frankly, a reprieve that we would welcome. And we just don't know yet. It could be that it's more contagious because people have milder symptoms. They're not seeking hospital care. They're maybe not even getting tested, and they're existing around other people. Right now, the contagious part of it is really just looking at the epidemiologic data, like how quickly it's getting around from person to person or community to community. That could just be a function of mild disease prompting people not to take cover, not to isolate.
Let's hope that that is the case. As you said, it's a little early for us to know for sure. I want to ask you about these new testing regulations for travel into the U.S. that go into effect today. Of course, this is just one of multiple parts of President Biden's plan to combat the virus and this new variant. Do you think that that's enough? I mean, we've already seen efforts to get ahead of new variants can be somewhat helpful, but the variant is going to arrive regardless. Are there any regulations or safety measures you think we need to or should be implemented either nationally or at the state or local level?
Listen, anytime you have more testing and it's more recent, that is better for sure. I've been an advocate of vaccine mandates for all manner of activities. I don't think you can mandate vaccines for every individual just to exist, but you can certainly tell people, you can't go on a bus, you can't go on an airplane. I mean, flying domestically right now, we have 100,000 cases a day. And, we're requiring people to have certain testing to come from other countries that maybe don't have it as bad as parts of our country. But we're allowing people to travel across the country from place to place. Here in the U.S., they might be coming from a hotspot and be unvaccinated, but not requiring anything. I think we should require even more. I think vaccine mandates are the way to go. I applaud what New York City is doing. I wish that Republicans in the Senate and elsewhere and governors would get on board and stop resisting this. We're just trying to save lives. We're trying to get people back to normal as fast as possible.
Right.
Can't do it without people getting vaccinated.
It sort of comes down to the fact if you don't want to get vaccinated, then maybe go live in the forest or someplace where you're not interacting with other humans. Because at this point, in order to interact with other humans, you need to be vaccinated.
I'll tell you, I mean, we've seen a lot of protests and people very angry about having to be vaccinated or mandates or what have you. And I think it's about time the rest of us who are doing the right thing, who are protecting ourselves, our family, our neighbors, our communities, we start getting mad. It's extremely frustrating. And we get pretty angry when we see person after person coming in and really not with those people. I mean, we want to treat the people in front of us, and the empathy that is a part of our job is right there. But it's the people resisting vaccine mandates. It's the governors. It's folks in the Senate, particularly on the Republican side, who are making this harder for us. And that's where we need to direct some of that frustration and anger.
And the healthcare workers who are on the front lines, get hit the hardest. Well, Dr. Rob Davidson, thank you so much for joining us. We certainly appreciate it.
Thank you.